Thank you, Drushi, for a wonderful talk, and you have covered lots of points and make us a clear understanding of this topic. So now our next speaker is Dr. Isha Trivedi, and she has done her masters in cardiovascular and pulmonary physiotherapy from VS and SPP Hospital, and this is a very unique combination of physiotherapy and psychology. And she has also done a clinical psychology and a nutritionist. At a very young age, she aspired to become a holistic healthcare profession and make advancement. I would like to invite Dr. Isha as a speaker to come here and present in front of all you.
Good morning, everyone. So, what is plantar fasciitis? Plantar fasciitis is a common musculoskeletal disorder which is characterized by pain involving the inframedial aspect of the heel. It increases on the weight bearing. There are three changes basically seen. There are degenerative changes, fibroblastic changes, followed by chronic inflammatory changes. Now, what are the clinical features? As you can see, there is pain over the ball of the heel, tenderness on the plantar aspect, slight swelling may be present or may not be present, and painful first few steps, especially in the morning. Now, what is the pain pattern? So, during first 15% of the gait cycle, passive structures of the foot, that is bones and the ligaments stabilizing the ankle joint, take more than 120% of the load. Maximum stress is on the plantar fascia in order to stabilize the foot in the phase of the heel raised to toe off. So, the repeated stress is placed on plantar fascia and it leads to plantar fasciitis. Pain is relieved as soon as the weight bearing is discontinued. So now what are the treatment options? Well, a physiotherapist may have treatment solutions. Rehabilitation and physiotherapy approach for plantar fasciitis. So now how to relieve stress? The first basic aspect is relieving stress on the plantar fascia. So take first few steps on toes in initial weight bearing. When you wake up in the morning, take your initial weight bearing on the toes. The second one is UCBL shoe inserts. These are the orthoses which can be provided to the patients. An elongated soft heel pad or well padded medial arc can be given to the patient. Now the strengthening of the intrinsic foot muscles. So in morning, immersion of foot in hot water and toe curling can be done for the several times. It recruits the intrinsic muscles. Sustained toe curling with a hold and thorough practices throughout the day. So more repetition, more strengthening. And Faradic stimulation of foot, it is one of the modalities which a physiotherapist give to the patient. So the first one is placing in hot bath, intrinsic foot muscle exercises, toe curling exercises. And the third one is Faradic stimulation. Now maintenance of the longitudinal arc of the foot. So proper shoe inserts are required and walking on outer border of the foot. As you can see in the image. Other exercises are straight leg raising exercises. We call it as SLR. So it helps in regaining the strength and endurance of the lower limb muscles. Initially without touching the without heel touching the bed. Progress and hold and add resistance as per the capacity. As you can see. We have to do these exercises in supine lying position. Relaxation and manual release of the plantar fascia. So these are the exercises which can be given to the patient, and in that patient can perform actively. So the first is frozen cane roll. We can give it to the patient. A bottle can be given to the patient and the patient is told to follow the instruction. The second one is towel stretch. We can use TheraBands also. The third one is standing calf stretch. Fourth one is seated plantar fascia stretch which helps in the release of the plantar fascia as well. Plantar fascia massage can be given and Achilles tendon stretch can be given to the patient. So these are the commonly incorporated plantar fasciitis exercises, that is towel stretch as we heard, standing calf stretch, plantar fascia stretch, static and dynamic balance exercises, because in plantar fasciitis balance is due to the inflammation. Towel picking up, that we can consider is a toe curling exercises. Frozen can roll. Resisted dorsiflexion can be given to the patient. Resisted plantar flexion, inversion and eversion activities. Taping can be given to the patient. The steps are given accordingly. Now, what is the take-home message? Plantar fasciitis accounts for an estimated 11 to 15% of all foot complaints requiring professional care in adults. Studies have shown that 90 to 95% cases of plantar fasciitis resolve within 12 to 18 months of conservative management. Hence, timely taken rehabilitation and physiotherapy treatment in plantar fasciitis can be much more helpful and effective. Thank you.